You remember in school that old saying, the only dumb question is one that's not asked? That is exactly the case when it comes to erectile dysfunction and your sexual health. There are no dumb questions. If you don't know something, ask. That's what your health provider is there for.
You've chosen well in Dr. LeRoy Jones. He's an expert sought around the world. He's trained over 1,000 other doctors on penile implant surgery. He's been on training missions to 16 countries and counting. Jones is president-elect of a national organization for doctors in his field. He's done around 2,000 implant procedures and does well over 100 per year. He's also easy to talk to. Nothing's off limits, nothing's dumb or silly.
I like interacting with the patients. I mean, to me, it's just great.
Maybe you've heard of implants and thought they seemed drastic, expensive, impractical, or scary. That's what I thought. As a network reporter and anchor, I covered hotspots around the world. I anchored a health program all about diabetes on CNBC. But ED haunted me. I tried everything. Pills, a vacuum device, even injections. When I first heard about implants, no way, I thought. Dr. Jones gets it.
Thinking about it, gosh, my penis, I'm going to have surgery down there. Is it going to be the same? And
until I had my procedure featuring an American medical system's implant and regained my sex life, I had no idea how depressed I'd become.
You'll be amazed how different you feel. This is about so much more than sex, though sex is a big part of this. After solving your ED problem, you'll feel more confident, more secure in every aspect of your life.
So let's tackle some myths about implants. Number 1, no way I could afford it. My insurance won't cover implants.
Most insurances will cover this. Medicare covers it. It's our job to find out if your insurance will cover it.
Number 2, it's not going to feel natural. I'm going to feel like a robot or something.
In general, when you talk to guys that have implants, it's as close as to a natural erection that you can have. And in my patients, they have a partner that doesn't know that they have an implant. The partners can't tell. So it feels natural to the partner and feels natural to the patient.
People will know. My partner will know.
That's a big myth. When the patient is in the flaccid state, in the shower, the men's locker room, nobody can tell that there's an implant inside of them. There's nothing hanging off of them by any means. Nobody knows about it. You can go through the x-ray screening at the airport and I mean, implants have been around for over 40 years, and so there's no sign that's going to flash up, no alarms are going to go off. In my patients that are not married, again, different partners, the partners don't know that they have an implant. They just think that the guy is unbelievable because the erection doesn't go away.
Number 4, it's going to be hard to use. It may go off by itself or I'll lose the moment.
The patient has complete control over inflation, deflation, so you can't bump it and then it comes up. It doesn't work like that. It has to be very deliberate, and it takes a little bit of time to inflate it and quicker to deflate. When the penis is erect, it's going to look and feel like a normal erection, a natural erection, and whatever they did before, they can certainly resume and do again. They'll be able to function just fine. And it doesn't take very long to inflate it, and it doesn't take very long to deflate it.
You don't take any chances with your health. If something needs to be checked out, you deal with it. You don't wait. Why would your sexual health or erectile dysfunction be any different? It's a quality of life issue, and there is help.
Implants work for me. A brief procedure changed my life. Learn more. Visit edcure.org. Dr. Jones can help. Remember, implants equal hope.